myself, I'm a clinical resource nurse, which is a new project we started last May, so that we have some coordination in the evening and night shifts as well. Other positive things about our institution is we have CCAC in the building Monday to Friday, and they come around daily for rounds with the charge nurse to discuss all the patients that are in our facility. At this point, we are just doing the weekly multidisciplinary rounds, and we've started having meetings with our team, including all the multidisciplinary rounds that are involved with the flow. And some of the decisions we've come up with is to start with our easy goals, and of course that would include the whiteboards. Initially we're going to start with the board at the desk, and we hope to make some trips to some of the places that have already instituted that, and again learn from their learning process. We also have to personalize it, of course, because some of the extras like OT and social work aren't really available in our institution. We already have an interdisciplinary database, which we do on admission, in place in our facility that does queue us. Does this patient need physiotherapy? I think the last question on the page is, from the patient's perspective, what do they feel they need to be discharged home? Do they need extra support? We decided that we would start with both our units. We're just a small hospital. We only have the 2 units, and the same doctors visit both units, so we decided that we should just start with both and go from there. I think we're going to set up some presentations initially to, again, educate the rest of the staff, and so we're all on the same page as far as the flow strategies. And we have a target date of April 1st, and I think that's probably about, unless you have something to add, Deb?
Yeah, I'd like to add that I think in our hospital, just like in Woodstock, saying that their hospital is very, very much part of the community. Goderich is only 7,000 people, so the hospital there is a big part, and I think that the education of the client, or the patients of the clients and their family, is going to be really important, because patients and their families right now feel that they can bring their loved one to the hospital and we will fix all their problems. I think that it's very important that we educate them about this project so that they can be involved in the care plan and in the discharge plan. The Southwest CCAC uses a client-driven care approach, and I think that that approach would really help us in our hospital to involve them. I think we would be much more successful if we use that. Also, the physician education is going to be really important, but our fearless leader, Cheryl Taylor, assures me that she is going to tackle that initiative, and hopefully we'll be successful.
At this point, some of our success indicators, like percentage of unplanned readmission within 1 week, we are less than performance standard. For the last quarterly, we were 2.2%, and our target, of course, is 2.3. And ALC, the target was less than 24.4, and year to date, we are at 22.2%. So I think we're going into this with good standings, and I'm quite sure that we'll be very successful with this. Thanks.